Let's meet our panelists. Dr. Kimberly Haynes-Reese. Dr. Reese graduated from Boston University School of Dental Medicine. She joined Aspen Dental in 2011. She served for 2 years on the Texas State Dental Board and is currently the board examiner for the Western Regional Examination Board. Dr. Haynes was also recently appointed to the Statewide Health Coordinating Council by Texas Governor Greg Abbott. She owns 3 practices in Texas.
Oh my goodness! Welcome guys to Aspen Dental Vibe. My name is Dr. Kimberly Haynes-Reese. I'm the practice owner for the College Station, Killeen, and Round Rock locations. I look forward to speaking with all you guys. Bring on the questions. Got answers. Got lots of answers. Look forward to talking to you.
Next up, Dr. Ashley Keene. Dr. Keene is a graduate of Louisiana State University's School of Dentistry. She joined Aspen Dental in 2013. Dr. Keene was Aspen Dental's Mentor of the Year in 2017. She practices in Sun City, Florida.
Hi, I'm Dr. Ashley Keene, MCD and partner in Sun City, Florida.
Dr. Alexander Williams is a graduate of the Oklahoma College of Dentistry. He joined Aspen Dental in 2016 and now owns 11 practices in Oklahoma.
Hey guys, my name is Dr. Alexander Williams and I'm a dentist and practice owner in Oklahoma.
And our moderator for today's session is Dr. Joel Lowsky, Director of Academic and Industry Relations for Aspen Dental Management. He joined ADMI in 2018, is the ADEA Corporate Council member at large. Dr. Lowsky launched the AspenDentalCE.com website and the AMA, or Ask Me Anything series of live Q&A questions with Aspen clinicians. Dr. Lowsky and the academic team have hosted over 600 events. He and his team have been instrumental in bringing over 1,000 doctors and hygienists into the Aspen Dental Network.
Just a second, I'm moderating a very important discussion here. Hi everybody, I'm Joel Lowsky. I'm Aspen Dental Management's Director of Academic and Industry Relations. I'll be moderating the Ask Me Anything session today, and I couldn't be any more excited to moderate it. We want you to pose any questions you might have. The doctors are going to give you fantastic answers. Don't hold back. Find out what you want to know. It's going to be a great session. Thanks.
Thanks for joining us today. Let's get started. Into the Aspen Dental Network.
Just a second, I'm moderating a very important discussion.
Hi, folks. Thank you very much for joining us today. I'm Joel Lowsky. I'm the one with the dogs. And per a question that just came in a moment ago, the dogs are not participating today. But we do have 3 fantastic Aspen Dental practice owners joining us today. You saw their introductions. What I like about the AMA events that we do, there is no set agenda. You folks, the audience, get to determine what the topics are going to be. So I'm going to dive right into it. We have only about an hour. We have already over 300 questions. We'll do my best to get to as many as we possibly can. So we're diving right into it. And I'm going to start with this one. It's probably a hot question on everybody's mind. Do you have all the PPE you need, and have you had the vaccine? Dr. Williams, let's start with you.
Oh man, you would start with me on this one. So I have not got the vaccine yet, to be perfectly honest with everyone. I am interested in getting it. I definitely will as soon as it's readily available to us. But as far as PPE, we got plenty, tons, more than enough. They just keep coming in, and it's just so awesome to be partnered with Aspen Dental, who's making sure that we are fully equipped to handle anything that comes our way.
Thank you. Ashley?
Yes, actually, I've got my second dose of the vaccine on Monday, so I am feeling good, happy, and a little bit of peace of mind. But like Alex said, we have a ton of PPE. We have more than we need. I actually had to ship some back because they kept auto shipping so much stuff to my office that I just didn't even have room to store. So it's not been a problem.
Great, thank you. And Kim?
Unfortunately, no, I haven't been able to get it. Every time I register, like most Americans, they send me an email stating that they have run out of initial doses. Oh, I'm in Texas, so I don't know if this is just something that we're dealing with locally, but I do plan on getting the vaccine whenever I'm able to get that email that says that I'm eligible and can go in.
And are you adequately stocked with PPE?
Oh, absolutely. Yes. Yes. Absolutely.
Great. So I like to leave most of the questions up to the doctors. I know that's who you're really here for, but I will chime in every once in a while. One of the advantages about Aspen Dental Management that we provide to the practices is because of our scale, we're able to make substantial orders of PPE, and so we are readily available with it. During the height of the crisis, and some would say we're still in it, but we pledged and we've been able to follow through. Every practice has at least 30 days of PPE on hand. And that's across all 850 odd practices across the network. So thank you. Let's stay on the COVID topic for a little bit. Has COVID had an impact on the number of patients coming in? Kim?
I would say no. We are still seeing a nice number, about 5 to 7 new patients a day. I would say what I have seen more of is emergency care in my office. So a lot of more people coming in with pain, abscesses, things of that nature. Generally haven't, a lot of Americans unfortunately have lost their dental insurance. So we are dealing and navigating through that. And luckily our office managers are trained to help people get payment plans and whatnot. So no, as far as the flow is concerned, I would just say it's more or less the scope.
Great, thank you. Dr. Keene, what about you? Have you seen a change in your patient flow?
So where my practice is, we have a lot of elderly people. So it's hit or miss. Honestly, it's up and down. Right now, we're pretty consistent, pretty steady. The month of November was kind of slow for us. So we've been up and down a little bit, but up and down for us, we're still busy. We're still treating patients. It's just not as busy as we're used to it being. But I do agree that we've seen a lot more emergent care. There's other offices that aren't open. So we're seeing patients that have established dentists that no longer have a place to go. We've seen a lot more of that. And cracked teeth. I've seen a ton of cracked teeth for some reason. Must be the stress. I don't know. 2020 was rough on all of us. But we're consistent. The patients are coming in the door, so it hasn't slowed down this year as of yet.
Great. Alex?
No, absolutely. I think that they're both dead on as far as their responses. Initially, we had some volume issues, obviously, early on, whenever we were all struggling through that time of the pandemic, where they were kind of restricting what we could do across the nation, and that was really, really difficult. I think what we have found, though, is that, I am seeing that there's a lot of private practices out there that are still trying to get off the ground. And I think that is encouraging our volume amongst our Aspen Dental practices. So I do think that the volume has picked up tremendously. And I think people we're definitely seeing a higher emergency volume as well, which I think is great. It's a big part of what we do. So good answer.
Well, thanks, Alex. That actually leads us nicely into our next question here. For those of you that have practiced at a private practice, what would you say was your biggest gain and your biggest loss when you left private practice and joined a DSO? Alex, let's start with you.
Yeah, so obviously I came from a line of dentists. My dad, brother, and uncle are dentists. I was an anti-DSO kid when I was in dental school. I absolutely hated dental service organizations. I was like the guy telling everybody, don't do it, don't sign your life away, yada, yada. And, I ended up going because I had everything. I knew my path, I knew where I was going. So I went back home, which is a small town north of Tulsa in Oklahoma. And I knew exactly what I was going to do. I was going to practice there, raise my kids there, and do everything. But the truth is that, giving up the things in private practice would probably be like, that's a challenge because I really haven't had to give up a lot from the switch. Being an owner here or being an owner in private practice, I think that truly it's probably been easier here than it is in private practice. Some of the things that you would think about is like vacation time. Some of those things that you may, not as easily be able to do in a private practice setting. Here, I've got doctor coverage. I've got opportunities to do those things. I can step away from the clinic and it's easier on me. But do I have a relationship with a business management team? Absolutely. I think that's probably the biggest difference. In private practice, I made all the decisions. I made the decisions solely, 100%. whether it be about my marketing and advertisement plans or whatever it is that I'm doing with my employees. Now I've got somebody to shoot those ideas off of. And some would call that, restrictions. I don't. I call that a great partnership that allows me to use somebody who has a better expertise and knowledge in helping run my business. So that's it.
Great, thank you. Kim, did you work in private practice?
No, I was more community health prior to Aspen and faculty practice at BU. So no, I didn't have the opportunity to serve in private.
Okay, thank you. Ashley?
No, I started with Aspen right out of dental school, so I was never in private practice.
Okay, thank you. Moving right along here, another question about your pre-Aspen life. Did any of you do a residency? Did it have an impact, and would you recommend a residency program? Anybody? Go ahead, Kim.
I did do a residency, and I did believe that it was absolutely fundamental in my ability to treatment plan and also gain my confidence. So I do recommend residencies, obviously, because if you're not able to partner with a mentor doc very early after graduation, residency programs are a really good option.
All right, Kim, somebody's paying close attention because this literally just came in. I would like to know more details regarding the mentorship when starting with Aspen Dental. So Kim, do you want to go lead with that?
Yeah, so one of the great things that that's available to new doctors is a partnership with a mentor doc. And also programs that are available in Chicago to go and help you learn, whether that's about implants, whether that's treatment planning, whether that's bedside manner, whether that's how you navigating yourself through a dental office every single day. The beauty of dental school is obviously they give you the tools to practice, your hands clinically, but then what about navigating with staff? What about managing your schedule throughout the day? And those things can be quite stressful. So essentially you're partnered with a doctor, and I myself, and I believe all the doctors here on today are mentor doctors, and we work with obviously they're not students anymore, right? Any new dentist, and essentially we just help them understand how to get out there throughout their day without being stressed, without understanding how to just be a dentist and what that means and provide good quality care. So yeah, it's a great program.
Thank you, Kim. Mentor of the Year 2017, Ashley. Can you talk a bit about that?
Sure. So basically, every doctor who is hired with Aspen is hooked up with a mentor doctor, like all of us are, and they spend 4 weeks at minimum with us. So week 1 is getting comfortable, learn the office. Where is sterilization? What do you do in between patients? How do you do your notes? What is life like as a doctor in the real world? And then it's starting to do procedures. I might assist with them. They might assist with me, might go back and forth. Who knows? It depends upon the individual person. The nice thing is because it's one-on-one, it's completely tailored to that person. So their strengths and weaknesses, things that they know really well, things that they don't know really well. Every dental school is a little bit different. Some schools are more clinically based. Some do more extraction. Some do more restorative. So it's not one size fit all. So we try to specialize everything to each individual person. And by the end of 4 weeks, that mentorship doesn't end. Those people are always available to reach out to me. I'm sure to all the other mentor doctors as well, and have a constant foundation, somebody to always talk to, always reach out to, no matter what they need.
Great. Thanks, Doug. Alex, what about you? What are your thoughts on the mentorship?
It's fantastic. That's probably one of my favorite things to do. I come from a line of educators in my family, and I really enjoy the mentorship program. Just being able to work with all the doctors. I've helped train not just doctors within inside of my PLLC, but also outside of it with large group practice settings. A lot of new grads get to come in here, and like Ashley was mentioning, every single doctor is going to be different, and it's crazy because you get to see so many different risk adverseness. You get to see where they struggle or where they excel. And it's really fun to just hone in on those areas and just kind of help them grow and reach new levels. But as far as what was Dr. Reese was saying, is it's really important to just kind of realize that these guys come out of school and they may go to an AGD program or some residency, and that can be extremely helpful. But I can tell you this, when I went and started working with my dad and brother, that year was so pivotal for me. That was so important for me to have that mentorship my first full year. That got me to the level that I needed to be able to handle running a practice on my own. And that's really how my entire path started, was definitely under some sort of mentorship.
Thanks, Doc. Ashley, I think this one is directed to you. How was the transition from dental school straight to work in Aspen?
I found it to be pretty straightforward, because a lot of how I was taught in dental school is how we try to do dentistry, comprehensive. We want to treat the whole patient. We don't want to treat just one problem. We want to look at the patient as a person, not as a mouth. So reviewing medical histories, coming up with a comprehensive plan. I think the hardest thing for me right out of dental school was just getting used to the flow of seeing multiple patients at a time and managing a team. You don't do that in dental school. Getting used to working with an assistant on every patient. What is that? Four-handed dentistry? You don't do that in dental school. So there were growing pains, but the nice thing is that Aspen's provided the network and the substructure, the platform for us. It's all set up. It's all ready. You just have to find your own feet.
Great, thank you. So folks, I sort of jump around questions. I'm trying to get to as many as I can. And seems to be a lot of questions about the schedule. So as an associate, who makes and manages my schedule? And then this person is also interested in who manages the hygienist schedules. So Alex, why don't we start with you on that one?
Yeah, so in my practices, you're going to work alongside your office managers. Every single practice is going to have an office manager or an assistant office manager helping run that practice location. They're going to be kind of going through new patient experiences with you, working through a system to help kind of define what your criteria is for each treatment option. You're going to be looking at your different time lengths, and then obviously you're going to have them scheduling where it fits. So, it's not going to be a one size fits all like we've already mentioned. This is going to be very tailored to each individual specific doctor. Some doctors, it may take 2 hours to do a molar root canal, whereas a lot of the practice owners and a lot of my partners, they can do a root canal in 45 minutes or an hour. And so we do structure the schedules very different for each of them. As far as the hygienists go, the hygienists actually involves themselves quite a bit in scheduling their own patients. And I think that's because of the way that we incentivize and the way that we structure our hygiene department, which is more specific to their bonus structure and how they run their own kind of practice inside of our practice. And it's really awesome. I definitely would encourage anybody who's interested to dig deeper into the hygiene world of Aspen Dental.
Great, thank you. Kim, anything to add on that on the scheduling?
I agree. I think one of the things, going back a little bit, tapping into the mentorship question, I like to sit down with doctors and figure out where their comfort spot is. So what makes you feel comfortable as far as the number of surfaces that you can do per hour? What makes you feel comfortable as far as, like Alex said, root canal? And so essentially that is given to the office managers. And so essentially when they do book a procedure for you, they pay attention to those time requests.
Great, thank you. Ashley, anything?
Yeah, just at the end of mentorship, that's what I always try to do. We have a scheduling preferences form that the new associate will fill out, and it basically says for what type of procedure, how long they want, and that's given to the office manager where they're going. Now, of course, that's a starting point. Things change and evolve from there as the doctor gets comfortable in their office with their assistant, and it's in our nature to want to grow and be better. So setting goals for ourselves. All right, it might take me an hour and a half now, but by the end of this week, I want to be down to an hour. So setting timers, setting goals for yourself, always trying to be better, always trying to be more efficient and have better patient care.
But just to be clear, I have to ask: does there exist somewhere a list of procedures and the maximum amount of time that can be devoted to them?
No, not at all. Not at all.
Okay, I have to ask Kim. I appreciate the face that you made there. You looked a little disgusted by me.
I was like, oh my goodness, it'll be horrible. No, obviously not. Yeah.
Doctors don't like to be told what to do.
Might be a good idea. Might have to implement that, Joel. That's great.
Yeah. So there's some questions here about complex procedures, implants. They're complex to me. Complex procedures such as implants or root canals. So what is kept internally and what is referred out to specialists? Kim, you start with that, please.
Well, obviously we do anything that is in your comfort zone. So and I believe that's the hardest thing when being a new dentist is learning when to refer and when you want to take on a case. So I do implants, but obviously there are some cases that I have an oral surgeon, I have an endodontist, I have specialists that I have great relationships with, and I do refer. So it's really provider comfort. I guess that would be the best way to answer the question. That's how I refer.
Alex?
I hope I answered it. Did I answer it?
Yeah.
Okay, great.
So, it's very similar answer, but just to kind of elaborate a little bit, in my practices, we handle a lot of implants, a lot of molar root canal therapy, second molar root canal therapy. It doesn't matter. We do all on 4 cases. So, it really comes down to the provider and then really understanding what that, what the doctor or what the patient really needs. And like Kimberly was saying, that there's really a specific criteria you're looking for when you're treatment planning patients. Sometimes it may be a case that may be better in the hands of the specialist. And that's really a conversation that you've got to get used to having with your specialist. So there's a relationship there too. Figuring out how to communicate with your specialist, finding out what really is something we're going to be offering, to be with him and be with our practice, our general dentist. But either way, the opportunities are there to handle some really interesting cases and really dive into new fields. It's awesome.
Thank you. Ashley, anything to add?
Yeah, they pretty much hit it on the head. We have oral surgeons and endodontists that come through to some offices, most offices. I don't like doing endo. I don't do endo by choice. Not my thing. I have an endodontist. She does my endo. But yeah, I place implants. I also have an oral surgeon. So if it's a medically complex case or something that I just don't feel ready to take on or don't have the time to take on when I have other patients to see, then to the oral surgeon they go. So it's whatever you're comfortable with.
Great, thank you. So there's a few questions here that I'm going to combine into one, and I think I'll give the first answer on it. So one of the questions is, are there options for dental student loan repayment? Another question is, what do I do if I want to join Aspen, but I have a restrictive covenant from my current job? Another question is, what duration of contract do Aspen usually give, and what preference would you recommend? So I'm going to bundle all of those together. Aspen Dental does not have contracts. We have what's called an agreement, and there's no duration on it. And we also don't have restrictive covenants. Just in case folks don't know, and not everybody does, a restrictive covenant really means sort of a geographic area where you can't work if you leave your current job, and that's for a certain period of time. And we don't have them because it's karmically horrible, and because we're not out to ruin somebody's career if we aren't the right location for them. And then regarding student loan repayments, all of these answers in a way are linked to the following. Of course, we don't have agreements, we don't have contracts, and we don't have restrictive covenants, but a lot of the decisions for your employment are made by the practice owner. So something like student loan repayment comes down to the discussion that you have with your individual practice owner. All the practices are owned by dentists. So Aspen Dental Management, the company that I work for, is not going to insert ourselves and say things like, you have a maximum amount of time, you have to have a restrictive covenant, or here's the loan repayment plan. Does anybody want to add to that, or was that an adequate answer?
I think that's
No, I think
great.
it's fair. I think it's
Yeah.
true. I think go for it.
Kim, go ahead.
I was actually going to say I just signed my first loan repayment maybe a few months ago. So yes, it's absolutely an option. Definitely.
Great, thank you, Alex.
I wish I would have had it, that option early on.
Yeah, no, it's a great option.
Yeah.
I think it really does come down to the different levels of providers and where you're located. And obviously, geographics make a huge difference. Obviously, I'm in Oklahoma. There's a lot of rural opportunity out here. Little harder places to kind of find dentists who are interested, and those are going to be more areas that we're going to focus on offering those opportunities to. And you said that these are agreements, they are, but whenever you start looking at certain situations where we're paying for student loans, then it becomes more of a contractual thing versus an agreement. But again, whenever it comes to just baseline, just standard employment, yes, just there's no contracts, just agreements.
Thank you. Ashley, anything to add, or we're good?
Yeah, I'm good.
Thank you. There seems to be a very important question here. Are all four of you dentists? The three panelists are dentists, and I have a doctorate in Ask Me Anything moderation. Very challenging. Can you folks elaborate a little bit on the relationship that you have with your specialists? What the agreements are, what you refer out, where the patient has to travel to if they have to travel, and so on. Ashley, can you start with that?
Sure. So I have an endodontist that comes to the office twice a month and an oral surgeon that comes once a month. They travel to areas within the territory. So they set where they're willing to travel to. I don't set that. That's completely up to them. And they set their schedule, what days they want to be in what offices and so forth. The patients are... like if I have a patient that needs a root canal, I'm going to schedule them in my office the next time the endodontist is there. However, if the patient wants to be seen sooner, they're more than welcome to travel to another office to see that endodontist if they so choose. Totally up to the patient, whatever is best for them. The endodontist and the oral surgeon both travel with their own assistants. So they bring their assistants with them. And they just work out of an operatory or two out of my office when they're there. So we know when they're coming. We know how to manage the schedule so that it doesn't become overbooked with too many people and not enough places to put people. And I mean, that's pretty much it. Straightforward. The nice thing is with them being in the office is you have a direct line of communication with them at all times. So if they're mid-procedure and my endodontist comes to me and is like, hey, doc, this tooth's not restorable. What do you want me to do? Hey, plop them in my chair. I'll go ahead and take the tooth out. Not a problem. Patient's already here. The patient's already numb. We don't have to bring them back again. It's a quick conversation with the patient and the other doctor and the provider. And the patients really enjoy it. They like being able to stay in the office and you don't have to refer as much out.
Thank you, Ashley. Alex, anything to add on that, the relationship with your specialists?
Yeah. She killed it on that answer because I mean that's pretty much to a T. It's incredible. But no, I don't think you can put a price on what she just mentioned. Them being in your practice, having that relationship, being able to just simply I've got my oral surgeon phone number. We pick up the phone, we talk. I can ask him questions. It's incredible to have that kind of relationship inside of your own four walls. And so, no, I think she did a great job of explaining it. Couldn't do any more.
Great, thank you. Kim, I think I saw you nodding in agreement. Is that right?
Yeah, both of them. Same. Agreed.
Great. Thank you. All right, folks, we're going to go a bit of a different direction here. I would like to learn how to utilize CBCT technology and how to implement CBCT into practical use. How are new technologies rolled out? So do any of you have CBCT scanners in your practices?
Yeah.
Okay, that's a lot of nodding. We're going to go in order down my screen. Ashley, go ahead.
So the CBCT, if you're placing implants, I believe that's the standard of care. I don't think that, especially as general dentists, we really should be placing implants without the proper information before we get into the case. Again, being part of a big network like Aspen Dental, we have great connections with vendors and companies. And so we get the industry leading prices. And when they're rolled out, they take care of us. We get the training and the support, the tech support, the staff support that we would need in order to make a seamless transition in the practice. So the CBCT is already in a lot of our practices, if not the majority. The new offices are opening with CBCTs, and we have Dr. Rawal, who is wonderful, and he's leading our implant platform, and he's a wonderful resource for helping reading them, or if you have questions with them, there's always someone to ask. We have a ton of doctors placing a ton of implants, so there's always somebody there for you.
Great, thank you. Alex, anything to add on that, the utilization of CBCT scanners?
Not really. I think she's right. I think that the standard of care is definitely shifting. 5 years ago, if you had asked me, I didn't have a CBCT when I was placing implants, and obviously I was making a lot of educated guesses on panels and all that good stuff, and that was fine. Obviously, there was a time and a place for that. But now the CBCTs are so readily available. The relationships that we have with ADMI and all the suppliers just give us that opportunity to kind of have them spread out amongst our practices. I've got them in the majority of all of my 11 practices. I've also got iTeros for 3D scanning. We've got the ability to combine that technology to kind of push into a guided surgery system for all of my newer doctors who are uncomfortable, or maybe they're growing with implants and they want to be a little bit more safe, I guess would be the best way to put it. But at the end of the day, just having that and offering that to my new docs that are getting trained in implants, it's fantastic.
Great, thank you. Kim, I'm going to add another question for you. How did you learn how to use the CBCT scanner?
We had training on it. Obviously, even when you have training, you always want to make sure that you follow up with just continuing education. But just one thing I wanted to add, obviously we use the CBCTs for implants, but I mean, now that I have it in my practice, I pretty much use it for endo, wisdom teeth, tori removal, things of that nature. So, I mean, it is, I think, revolutionarily changed even the way that I practice and look at dentistry. Same, like Alex said, with the iTeros, just looking at occlusion. So overall, having both of those in my office has been truly a great asset, and I've been really happy to treat patients with those tools. So I'm happy.
Great, thank you. Would any of you like to comment on other fancy technologies that you brought into your offices in the last few years?
Fancy?
Actually, go ahead.
Sure, we're always getting fancy technology.
Dude, yeah.
It's where we stay up to date with the technology and the changing landscape of dentistry. This company is wonderful at that. And so if there's a new something cool out there, there'll be a pilot program and they'll try it in a couple offices and make sure that it works and fits our model and fits our patients. And then they're like, okay, everybody gets one. So we've had the iTeros were wonderful. iTero digital scanners were wonderful. I know we're partnering with 3Shape and Trios and all of these new things that are coming out. They haven't rolled out yet, but they're coming. So digital dentistry is here, and we're not shying away from it. We are leaning into it. That's where we're headed. That's what we're doing. So that's what Aspen will be.
Great, thank you. I'm sorry, Kim, go ahead.
I was going to add, the paperless systems that we have now, I think are really important to mention. So that's also been really nice with the iPads and the patients signing in, doing their medical histories and things like that on the iPads. So that's been added, I believe, within the last few years as well.
Great, thank you. We're going to go a bit of a different direction here. And again, we call these sessions Ask Me Anythings, and we like to say that there's no question that's off limits, so we encourage the difficult questions. This person was quite polite when they wrote it. I don't know how to say this, but in some circles, DSOs don't have a great reputation. What do you think of that? Alex.
All right. So as I had mentioned earlier, I actually was an anti-DSO kid. I, for a better word, hated DSOs. I thought they were a threat to my family's business and what we lived and breathed every day. My dad's had a private practice for 35 years. He's a lead instructor for the American Orthodontic Society for general dentists. It's a big part of my life, and it was a big part of the community. So for me to simply, jump ship and come join a DSO, that was a pretty big deal. But I'm telling you, I thought it really came down to, I believed that there wasn't clinical autonomy. And I think that's where it gets its stigma. I think that's where it comes from. because I think if you knew the types of patients that we treat, I think if you knew that you had the clinical autonomy, that would not exist, that stigma would have to be removed, because you would absolutely see it for what it was. My brother actually eventually left the private practice too, and he came and joined me, and he's a partner with me in Oklahoma. And that was one of the first things that he said. When we would talk at Thanksgiving and Christmas and every other event that we got together and talked about dentistry, it was always, well, I know you're over treatment planning over at Aspen Dental, and that's fine. I guess that's what everybody thinks out there. But the truth is that once he got there, he started to realize, like, holy crap, you're not over treatment planning anything. You're being comprehensive. You're being comprehensive with your patients. Your patient demographic is specific, and it's very, very amazing the type of dentistry we get to do every day. It's very different than the private practice dentistry that I was doing. So I think that what I would tell anybody is, come check it out. If you have those questions, you have those fears, don't let it be. We're super transparent. Come on in.
It's true.
I'm sorry. Important follow-up question for you. You're still at Christmas and Thanksgiving?
Yes, I do.
All right. Very good. Kim, what about you? The question is the reputation of DSOs.
Obviously there's naysayers. There's people that don't understand exactly what we do here. And that's okay. One of the things I had to do was recognize that I'm the treating dentist. I own my treatment plans. I take care of my patients. So regardless of what setting, I believe that it's about who you are individually. So regardless of a reputation, not a reputation, I know the great things that we do here. I know the great things that my staff and all the other practices do every day. One of the reasons why I, like Alex, initially was a little skeptical as well. But one of the reasons why I have decided and have continued to be with Aspen Dental has been the patients that we see and the patients that we market to. This demographic resonates with me. Like I said, I was in community health first, and then I dibbled and dabbled with being faculty practice at Boston University. But when I came into Aspen Dental, the patients that need our care are so incredibly unique, and I feel like the best humans, and have blessed my life, just in their treatment. I can't imagine being in anywhere else. So it has blessed my life, and for that, regardless what anyone says, I'm happy with where I'm at.
Thank you. Dr. Keene, anything to add on the relationship issue? Sorry, the reputation issue?
No, the only thing I would say is we're the largest branded dental office, right? Our name. When you see Heartland, they all have different names. When you see Pacific, they have different names. We're a branded company. So it's easy to point fingers and it's easy to play the blame game, but there are good dentists and there are bad dentists everywhere. But the nice thing about being with Aspen is that there's always another doctor there to help, and if there is something, if they see something that clinically isn't acceptable or something like that, they're able to help you through those things. Whereas you're not on your own, you're not on an island. It's easy to, when you have 900 offices, 900 locations, to be like, they're all bad. But it's just not the case. There's good private practice dentists and there's bad private practice dentists. And are there good Aspen dentists? Absolutely. Are there bad ones? Yeah, probably. But that's it.
They're excellent. They're just slightly less excellent.
That's it. That's it.
Well, thank you. We have over 400 people watching today, and let me say a heartfelt thank you to everybody for taking time on the weekend to join us. But it seems like some of the people that are attending today are not students, experienced in this. So a couple of questions for those folks, though I think, of course, the answers will be appealing to everybody. I've been working as a dentist. What would you say will be the hardest thing for me if I join Aspen? What will be the easiest, or what are the biggest differences that I should consider? Everybody looks confused. What would you say will be the hardest thing for me if I join Aspen and leave private practice? Kim?
Hardest thing, I would just say our culture is and our mission is very unique. And I would believe if you're able to understand what that culture is, and essentially it's yes today, meaning that we say yes to patients that come in. We see emergency care. We say yes to having extended hours. We say yes to breaking down barriers and having patients come in and get treatment done. So all of these, it's a yes mentality. I think some of the time, that may be, if you're coming from private practice, may be a little unique because how skillfully the office managers and our teams are trained to make things happen, to give people dentures and things like that by the end of the week. That's more of a mind-blowing thing to a lot of places. So I would say one of the things would just be getting your mind around actually how we're able to make it happen. The schedules and things of that nature are fine. We make it happen for our patients. So I would say embracing that mentality and understanding that you can do it and we can make it happen.
Thank you. Dr. Keene, advice for mid-career dentists considering a switch into Aspen Dental?
You have to be open-minded, and I would recommend, I don't remember who said it earlier, but I think it was Alex, come see the offices, come see how we run, even before you decide to make that switch if you really want to. We're open books. There's nothing to hide. You can come in and see what we do. The easiest thing is dentistry is dentistry. It doesn't matter where you are. It doesn't matter what the name on the door says or what the signage says. Dentistry is dentistry. So just, I don't think it's that difficult of a transition, but Kimberly's right. It's a mindset. It's a mentality. It's a culture. It's you drink the blue juice.
Yeah.
Drinking the blue juice is not mandatory, and there's nothing wrong with the delicious blue juice. Alex, anything to add on that?
No, actually, at first I was like thinking, Kimberly, where are you going with this? Like with the culture, I was like saying yes today. It's like, yeah, that's the worst part. It's gonna be the hardest part. No, she's absolutely right. That is the hardest part of coming on to Aspen. You are going from a very different mindset. In private practice, it's on your terms. It's on your time. It's under your watch. But you may not have that same feeling to want to do things for patients, staying late, keeping your office open later on a Friday afternoon, coming in on a Saturday to treat somebody. These are things that in the medical world have been going on for years, but not in the dental world, right? So it's not uncommon for a medical doctor to be called up in the middle of the night to go treat somebody.
Oh, did we lose him?
Looks like we lost Alex, or he's just so frozen by his passion for Aspen Dental. I would say that's probably it. All right, so it looks like we've lost Alex, which is too bad. But we at Aspen Dental and Aspen Dental Management are very flexible. We're going to move right along. Hi, Alex.
I was getting a soapbox there anyway, so it probably was good timing. That was the universe telling me to stop.
Well, welcome back. Happy to have you. There's a couple of follow-up questions. All of you have made a comment about our types of patients and our types of dentistry. So could you please elaborate? Kim, we'll start with you. Could you please elaborate on the types of patients or the types of dentistry that you often see in practice?
I mean, type of patient, I'll start there. Obviously, we are treating patients that generally blue collar. Probably they're normally in pain, haven't been to the dentist for probably several years, probably because taking care of their kids and things of that nature. They are looking for solutions. They generally come in talking about one tooth, and are most of the time unaware of some of the other issues that are presenting in their mouths. They are motivated to get things done, but sometimes feel and don't understand how they can make it happen. the financial barriers and the stigma of dentistry and how much dentistry costs is generally in the back of their head. And some of the time they have a little bit of distrust with the, how do I say this? Dentistry overall. So that particular patient comes in, and it mind boggles me all the time because how skillfully we market to patients. And every day when I open my doors, I have 5 to 7, 8, 10 patients that are pretty much wanting the same thing. They're wanting care. They're wanting payment plans. They're wanting to be out of pain. So that would be more or less the type of patient I believe that question is asking for. And then what was the second question, Joel? What services do we offer? I think that was it. Services we offer would be, general dentistry, oral surgery, endodontics, implants. I think the only thing we don't do right now would be bracketed ortho. So that would be, I think that would be it. What do you say, Alex?
Yeah, I think straight wire orthodontics is the only thing that we don't really dabble in. We just handle just about everything else under the sun.
Yeah.
Great. Thank you. Folks, we've got just over 15 minutes.
Did we answer that question? Did they look?
Pardon me? Okay.
Did we get that? Did that answer the question?
Dr. Keene or Dr. Williams, anything you want to add regarding the types of patients, types of dentistry? I thought Kim's answer was...
No, she nailed it.
Okay, great. Thank you. We have about 15 minutes left, so I'll try to squeeze in a few here. Are there restrictions on dental materials or instruments that we can use? So I'll give a little bit of a response to them, and then we'll turn it over to the docs. Aspen Dental Management has relationships with pretty much all of the providers of materials and instruments. And as a result of that, we get very good pricing on some of them. And those are suggested to use because of the pricing advantages and the fact that we have developed a massive internal resource database of resources of skill of using those instruments. But I believe there is no restrictions on what you can use. If you want to use something that's not what we use, you're entitled to use that. Am I right on that, docs?
Yep.
Yes.
Great. Thank you. Clean and easy. I want to acknowledge this person who was very polite in their question, and politeness goes a long way. So the question is, hi, thanks for taking my question. You're welcome. How many dentists work per office and how many assistants work with each dentist? Alex?
So I think that depends on the practice, obviously. Every office is going to be a little different. Some offices are going to have a high volume. Some of them across the nation have 10 new patients every single day on top of their normal production and what we call an overflow chair, which is where we handle a lot of our denture steps. So in those practices, you're going to need more providers. You're going to need at least 2 providers, and it's sometimes 2.5 providers, where you're even adding some hours to the weekends or extending Fridays. So in those practices, you're going to have a little bit of higher employee count. So we may have 5 DAs or dental assistants, or possibly even a 6th dental assistant if there was an extra provider there. Then there are some other practices, obviously, that are going to be a slower pace practice, maybe 3 to 5 new patients a day. Maybe those practices only have 1 doctor, and maybe that office only has 3 dental assistants. But each doctor should have a dental assistant that is going to be there to help with their chair side. You'll have one that's helping with your overflow or your denture steps, and then you'll be able to have one that's helping you through your new patients every day. So taking those x-rays, charting with you, trying to help, get the hygienist in there and get those new patients cared for. So that's it.
Thank you. Kim, anything to add on that one?
No, I think he nailed it.
Thanks. Ashley?
The only thing I would add is that because our training structure is so good, that we are very good at cross-training people as well. So people up front are comfortable going in the back and flipping rooms or helping or doing pretty much anything other than making temporary crowns. So it's an all hands on deck. We're all there to help each other. So people can work my assistants answer phones and my people up front jump in the back. Whatever you need to get the day done.
Great. Thank you. I'm mid-career. If I join Aspen, do you think I'd retire as an owner, or will I always be an associate? And I'm going to lump in another part of that, which is how do I become a partner, or how did you become a partner? So Alex, why don't you start with that one?
Appreciate it. So yeah, as a large group practice owner, I do own and operate 11 practices and have currently 5 partners, and we're working on a 6th right now. So I believe in partnership. I believe that, I'm not going to be able to handle all of this on my own. I think that the first question was, do you think that I will be able to achieve that level? And the truth is that I think that it comes down to each provider. I think it comes down to their level of desire, and just their engagement, them opening themselves up to constructive criticism, I think is important. I think being able to take constructive criticism well is huge. Being transparent about where we can grow. It's a really, really tough question to ask. There are going to be a lot of guys who don't want the kind of responsibility that comes along with being an owner or a partner. It's just like anything. Owning a private practice, there's going to be the finances can sometimes really stress people out, and that comes with risk at first. So, no, I don't think that it's for everybody, but I do think that there's a lot of individuals out there that are going to be able to reach that level of success, financial success, I guess, is the best way to put it. That's all I can say.
Thanks, Ashley. Thanks, Alex. Ashley, anything to add?
I think if there's a will, there's a way. If you want it, you can make it happen, especially within this company. It might involve relocating. It might involve being at a different office than you originally thought you were going to be at. But I think if you really want it, make it happen.
Sure. Great. Kim, anything?
I think it depends on you. The resources are here. We have the training. We have, there's a lot at our fingertips. So it depends on you and what you're looking for. That's pretty much it.
Okay, thank you. Folks, there's absolutely no way that I'm going to get to the 361 questions that have been submitted. So I strongly encourage you, those of you that have interviews today, and those start in about a half an hour, if you have those interviews today, use that time to ask those questions. I encourage you to do that 100%. If you don't have an interview today, there's an option in the main lobby to request an interview. That'll probably take place next week. Great opportunity to ask those questions. And of course, if you're not up for an interview, but you still want to talk, please, again, just fill out that form, reach out to me. I'm available on LinkedIn. We're always happy to have the conversations. The docs have said it. The best way to learn is to arrange for a shadow and come in the office and see it. So please don't give up if we don't get a chance to answer your questions today, which I'm certain we won't. Not every question. So there's been a few questions about scheduling for clinicians. So I'm going to sort of bundle those questions together. How is my schedule devised? Are there extended hours available for me? And what if I want to work 4 10-hour days a week? Alex, let's go ahead with you.
Yeah, I think every single office is going to function a little differently. I think if you're working with a practice owner, I think that having those conversations and really just being transparent about your wants is really the first step to answering that question. If you came to me and you were a new grad and you said, hey, I would like to pick up some extra Saturdays, or hey, I'd like to work 4 10s, I would probably entertain those ideas. I have done that. I've actually extended more hours. I've given people some opportunities to kind of extend hours of care for our patients in our practices. So I think it really does come down to just having a conversation and exploring it.
Great, thank you. Kim, anything to add on that, creating the clinician schedules?
No, I think that would be a conversation with the practice owner. Just talk to him. I actually love extended hours. I love being available. I love Fridays. I love Monday mornings, Friday afternoons, so it's just a conversation you just need to have.
Great, thank you. Different direction here. How pushy are offices about getting patients treatment or over treatment to reach certain production levels?
Not at all.
Okay.
So we don't. I know they don't overtreat. We treatment plan what they need, and if they don't need it, they don't get treatment planned for it. But like Kimberly said earlier, a lot of our patients haven't been to the dentist in 7-8 years. So they might come in and have a $10, $12, $13, $30,000 treatment plan, but that doesn't mean that it was oversold or over treatment planned. It just means that that's what they've needed. It's our job as clinicians, whether you're in Aspen Dental, you're in private practice, you're with another DSO, to tell the patient what is going on in their mouth and the ways that they can fix that. And if that gets perceived as over treatment, then that's a mistake of miscommunication as opposed to improper treatment planning.
For sure. I'd like to add something to that too, Ashley. I think you're 100% accurate, and I would change nothing. But I would say that we also need to be cognizant of our liabilities. You know, I coach that to my docs. I tell them, like, look, this comes down to you. This is your license. You went to school for it. You're taking care of people. They don't make the decisions. You make the decision. And so at the end of the day, if they have 7-8 millimeter pockets and they haven't seen a dentist in 5 or 10 years, and they want to come in and get their cleaning, their standard cleaning that's covered by their insurance, then that's something that I'm going to put my foot down and say, I can't. You're telling me to put my license at risk now to underservice you. And I think that that's not just with cleanings. I think that goes with crowns and fillings and anything else we choose to do that could put them in a situation that could jeopardize our license. So that's just a little add.
Great. Thank you. So how do you handle patient complaints? I mean, I'm sure none of you have ever had one, but if you did, how would it be handled? Kim?
Yes, I like to speak directly to the patient to understand what the particular issue or challenge that happened. Generally, most of the time, the patients just want to be heard. They just really want their care. And if there's a way that we drop the ball on providing that care, we need to know about it. And I like to know. We also have a patient satisfaction line that they can call to express their concerns with the offices. And we also have our regional managers that also help navigate some of those challenges that come up in our day-to-day. So I think that's pretty much it. Did I catch on everything?
I think so. Ashley,
Yes.
anything to add? Patient complaints?
No, I think she hit it pretty spot on. We have, different levels, and I guess it depends also on what the complaint's about. I think a lot of the complaints that we get are really just confusion. A lot of times confusion about insurance, if I'm being honest. But yeah, she did a great job answering that.
Great. So folks, we've got about 5 minutes left, which really only leaves time for 1 or 2 more questions. There's a bunch of questions about compensation, and I don't want folks thinking that I'm avoiding them. I'll make a comment on that, and then I'll ask the docs if they want to add anything. Typical compensation for an associate is a guaranteed daily rate, which means you'll make this much no matter what. And then that is bolstered by a profit sharing percentage. Now, the key thing to remember is that both of those figures are determined by you, the candidate or the associate, and your practice owner. Aspen Dental Management, we can make some advice and we'll do the research on what the rates are in various regions, but that's almost like any other job. When you're talking right to the boss, right to the owner, your agreement with the owner will be determined by you and the owner. Anything to add? A quick and dirty summary of the compensation model. All right.
The thing that I would add that's a little bit different for us is that we're based off of whole office production. So it's not just the production that you produce. So it's beneficial for the practice owner or the lead doctor in an office to get an associate doing complicated procedures, doing the high dollar value procedures, because if you're both doing high value procedures, then you're only going to both make more money.
And I'm not going to rag on any other models, but there are models where the associate is kept away from doing those high value procedures if they're incentivized, if the office is incentivized on individual production. So thank you, Ashley. That's a great point. We've got just a few minutes left. I usually like to end this off with a prompt that gives you guys the opportunity to tell a story or recount something that maybe we haven't covered yet. And so I'm going to do eeny, meeny, miny, mo and start with Ashley. If you could tell us a little bit of a story about when you knew that Aspen Dental was really right for you.
Sure. So like I said before, I started right out of dental school. I didn't know what I didn't know coming out of dental school, but it was a great opportunity. I was drawn to the fact that I wasn't under a contract or a restrictive covenant, and I wanted to learn, and I wanted to see patients, and I wanted to have the support structure that Aspen provided. Quickly, once I got started, I realized that, hey, this is way more than I thought it was going to be. I really enjoy the pace. I enjoy the structure. I enjoy being challenged and supported. And it didn't take long to realize that I was going to stay. And then as I grew in my career, and bought into the practice that I'm at and built different relationships, I realized that there are things that I'm able to do that I wouldn't necessarily be able to do in private practice. A lot of private practice doctors are there by themselves, and they're worried about vacation time, and they're worried about sick leave or maternity leave. I'm pregnant with my second baby. I want to have somebody there that's going to be there when I can't be. And Aspen gives that to me. And the support, the community, being able to reach out to the other doctors or anybody at any time is just something that I don't tread lightly on. It's something that we maybe take for granted on a day-to-day basis. Dentistry can be lonely. You can feel like you're on an island out there by yourself. And being part of this community, this family that, Bob and Dr. Judge and everybody has developed over the years is just something that I'm very grateful for. And I know a lot of us are very grateful for.
Thank you, Ashley. Kim, what about you? What was the moment when you realized this was right for you?
I always laugh because it was the moment that I visited our central office in Syracuse, and they gave us a tour of the call center. And I was mind blown at the number of people that I saw on the phones, the ringing of the phones, how well it was organized. I mean, I just felt like it was Lion King, like everything about, that you see under, is under your purview. So that was the first moment that I realized this is where I needed to be, because I felt that if I had if those phones were ringing for my offices, then I was going to be okay. And then I just feel like it's been like that since then. When we rolled out, Invisalign with iTero, when we've had our implant initiatives. And then lastly, what always and has continued to resonate, especially this year, is how we were able to navigate during the COVID pandemic, and how we're continuing to navigate through the COVID pandemic, and how much they helped us as practice owners get through that. I'm a mother with a 5 and a 7-year-old, and I have 3 offices, and the way they helped us with the paperwork, I mean, I know that I'm in the right place. So it was a couple of things, and they continue to happen. So that's been my Aspen story.
Thank you, Kim. Alex, you get the last word. What was your "this is right for me" moment? No. Go ahead. Don't be shy. No, don't stare at me. All right. You know what? We'll take this up later. I guess Dr. Alex is so emotional he's not ready to comment right now. Folks, it's 1:46. I sincerely hope that you enjoyed this session. I got to as many questions as we can. They were great prompts. I hope we were able to give you the answers that you were looking for. Please continue to ask questions. Make sure you have the opportunity to speak with and shadow Aspen Dental clinicians. Thank you very much for your time. I hope you enjoy the rest of the afternoon and the rest of the Vibe session. Have a great rest of the weekend.